Good morning, everyone. I would like to call the Durham Recovery and Renewal Task Force meeting to order. Hopefully everyone's had a great week. I tell you, as we work our way through this pandemic, things change quite frequently, and we've had some significant changes this week in Durham. So I'm just gonna go ahead and get us kicked off and turn it over to Mayor Schul and Chair Jacobs to provide us with some updates.
Thank you. Shall I go first this time, Wendy?
Go ahead, Steve.
All right. Everybody, thank you so much for being here and for all of your work. It's just been amazing. And again, want to express my gratitude to everybody. I have just a few things to report on this week that I thought would be of importance to the group. One is that we had an excellent meeting early in the week that I have been pushing this idea of sanitarians. We had a great meeting with Chris Salter there from Rod Shop, with Rod, Wendy, Katie, Jody. We had, I probably missed a couple people, but it was just Dr. Akinboyo was there. And we also had two people from UNC Public Health who agreed to join us. It was an excellent meeting. Phil was there also. It was an excellent meeting. And what we landed on was that we really need, and Pilar was there as well. Pilar, I'm sorry, I forgot you. We landed on the idea of really needing community health workers, more community health workers who would go out and be out in our community with businesses and individuals and would be helping people follow the both the requirements and the recommendations for public health that we have. I'll leave it at that, except to say that it was a great discussion. There's a lot of unity around it. And there's going to be more work going forward to try to figure out exactly how that will happen. And either others on this call may have some more comments on that as well. We know that we want to concentrate on our Latinx community because we know that's the greatest need, especially at this time. And we want to be able to recruit people from the community to be able to help us do that. Another development, which I expect that some of you all have heard, but some of you may have not have heard, is that Durham Public Schools decided last night to go with all remote learning for the first 9 weeks, at least. One of the things that this implies is that the digital equity campaign is more important than ever, that we have got to make sure that we are all pitching in to make that work. Geoff is one of the co-chairs of that campaign. And may want to say more about that today. But I think that it just gives added importance to our digital equity work. And then the other report that I'll give is that Wendy and I did send the letter that you all had recommended to our city and county governments and our EOC folks to ask them to add in their budget requests and recommendations, again, at a very high level, to go along with requests of the task force so that the council and the county commission can have a well-rounded look at what their needs are. And that I discussed with the city manager the initial request that you all had made last week for roughly $14,000 for the communications plan, which the manager has agreed to go ahead and spend out of our city's COVID response funds. So that's underway, and thanks to Susan and her group for forwarding that recommendation. So that's my report, and I will turn it over to Wendy.
Thanks, Steve. And I just want to echo, first of all, my gratitude for each and every one of you and the ongoing work of the task force. You know, when you're dealing with a crisis, it always feels so much better when you are working together with other people and you feel like that everyone's in it together and supporting each other. And is the silver lining for me of this crisis, is just working with people in our community, all the incredible people in our community. Just to add on to what Steve said about our meeting with some professors from the Gilling School of Public Health, I'm really excited about us launching some version of a health ambassadors or health workers or a health corps. We really need that level of interaction in our community. And I know we'll discuss that more when we hear from the from Pilar today. But we know that it's not enough just to issue guidance, that it's going to take that type of real one-on-one interaction and conversation with people. And on another note, we did hear from the professors that they were really complimentary. Marielle, Ryan, everyone who's worked on Let's Get Out of the Bull, that was really we're following best practices of behavioral science and also, public health best practices in our approach. They talked about, and I'm not looking at my notes now, maybe Katie will remember that they've done a recent study that with focus groups, and most of the people who don't comply, it's more because of barriers that they may have, and whether that barrier is lack of information or not access to a mask, but that was the results of their own research. You all have probably heard, as Steve said, the news about the schools, the first 9 weeks being virtual. And I think one of my, as well as the digital literacy need, one of my questions to the task force and to our whole community and to a lot of the roundtables are, what are the ways that we as a community need to support that reality again of our children staying at home, learning at home? What is that going to mean for our parents, who maybe some of them have gone back to work and have been using daycare or childcare? And then how do we look at the resources that we have, our libraries, Durham Parks and Rec? I'd already got an email from the director of our regional YMCA saying, we're here to help serve families and help create supportive learning environments. So again, we have to continually shift and adapt. And I know he is a part of the Youth Services Roundtable, but I think this needs to, again, now we need to think about what do we need to do to support our families and our students now that they are going to be at home learning. I want to mention about our homeless efforts with the city and the county. We did approve an additional about $1.5 million for taking care of our homeless population. And thank goodness we had, after months of people working so hard, Drew, who's on this in this meeting now, I think, and other folks from the city and lots of people worked so hard to find a COVID housing or housing for the medically fragile. And we luckily had that in place when we've had our first positive cases among our homeless community. But the good news is that our system works, and we had places for people to go, and the outbreak has been contained. And I want to just give a shout out to one of our local landlords who participated. They're letting us use 2 duplexes. And so if you all know of, I guess we need to get the word out to the community that if we have landlords that are willing to rent out duplexes or apartments or properties, again, for this type of housing that we need. I'm excited to hear more about the launching of the Let's Get Back on the Bull campaign this week. So exciting, and the businesses that have joined. I just want to mention probably the news that you all have seen, that Walmart and Target and some of our major employers have now come out saying that they are requiring masks. I think this is huge, because when we are trying to create a norm around the wearing of face coverings, creating that as a social norm. And I really think that this is going to help us. Lastly, I want to say that there have been some updates to the executive order from the governor. As you know, phase 2 is being extended to August 7th. There's also now been a exception for people to use gyms and fitness centers if they have a letter from a doctor, medical provider saying that they need to exercise. So just want to make people aware of that. Also, there has been an allowance for venues to be able to hold the allowable number of mass gatherings for receptions or parties, or for some of the exempt events like weddings. So that is now allowed. I want to bring up the issue of non-compliance and how do we handle this as a community. We were notified, I'll just give an example, about possibly, and we don't know if it's true or not, of there being a dance recital at a local church, and that would not presumably be following the guideline of only 10 people indoors. And I just want to share that because I think we really need to, again, this involves now a church and an entity, that it's really incumbent upon all of us to find creative ways to still enjoy life and celebrate and experience the joys of children recital. And ironically, last night I read an article in the New York Times that was about this issue, and it was about how people are taking it outdoors and they're having outdoor dance recitals and they're doing it in parks. And of course, in our situation, we would need them to be 25 people. So I think, again, through our work, our just conversations, the roundtables, we need to emphasize again that we shouldn't stop living, but we've got to do it in safe ways. So I just want to share that, and again, look forward to all the great discussion we're going to have today.
Thank you, Mayor Schewel and Chair Jacobs, for those updates. And as you guys know, there's still a lot of work for all of us to do as we work our way through this pandemic. I will say, Chair Jacobs, what you said about Walmart and Target and others that are complying with the face mask. I actually went to Walmart, I think this past Sunday, and as I was coming out, there was a couple that was going in, and they were actually enforcing it because they told the couple, you can't come in without a mask. But then they were able to say, but here's some masks that you can put on to come into the store. And I think what that does is it really emphasizes the importance of the mask. So hopefully the next time that couple goes to Walmart or anywhere else, they'll recognize that I really should be wearing a mask. So that made me feel really good that, Walmart's not just saying they're going to enforce it, but they really are. So that was very encouraging. And I would like to also say, thanks for all the great work that all of you guys are doing, because when we kicked this task force off, I really didn't know what I was getting into. But working with you guys over the past, say, 50 or 60 days, it's been very encouraging to know that we brought together a great group of individuals who don't mind rolling up their sleeves and really getting work done, because we've accomplished a lot over the past 50 or 60 days. So thanks so much for your continued engagement. So I'm going to move us to our first co-chair update, and that relates to our budget process. And we spent some time at our meeting on last Friday talking about our budget process, and we've been able to put some more structure around that since our conversation. So Katie and I sent an email out on Tuesday outlining that budget process. And I know none of you are like me and have a challenge getting through all your emails. So hopefully everyone's actually had an opportunity to take a look at it. So I'm not going to go through the actual details that were included in our email, but I do want to speak a little bit about the timeline. So as Mayor Schul mentioned, he and Chair Jacobs sent out a request to city and county staff asking for high-level summaries last Monday. As I mentioned, Katie and I sent an email to all of you with the actual process, the guidelines, and the template asking you to submit any requests that you may be aware of. And I just want to emphasize the importance of really following the template that was included, because that template's really going to help us quickly prioritize the budget requests that we receive. We've asked in that email that by this Monday, you submit all your budget proposals to myself, Katie, and Ryan. And we're going to spend some time compiling the information, and we're going to pull together a small group of the task force, hopefully on Wednesday afternoon, to spend the time going through the request and working toward a recommendation that we can make to the entire task force the following Friday. On the small group or budget subcommittee, we've included myself, Katie, Ibukun. We're trying to identify the right person from the Emergency Operations Center. And there's two more individuals on the task force that I sent an email to, and you probably haven't seen the email yet, but I'll wait to receive a response from Pilar and Geoff based on the request that I sent. So hopefully we'll have them join the subcommittee as well. And again, our main goal is to come together on Wednesday, review the information, and make a recommendation to the task force on Friday. And also for the rest of the task force members that aren't on the budget subcommittee, on Tuesday, Ryan plans to send out all of the budget requests to everybody on the task force. So you have an opportunity to see everything that's submitted, so that when you see the recommendation that we put forth on next Friday, you'll have some context around the recommendation. So I know also we included in our email that we went out that we know that there's a couple of budget requests that we anticipate. So last week we spent some time talking about the communications budget request, and as Mayor Schul mentioned, approximately $14,000 of that budget request has been approved by the city manager, but the remaining pieces of that budget request will come through this process. So we know we have that one. I'm aware of a COVID-19 sanitarians budget request that's likely to come through. Also, I'm aware of a request related to Back on the Bull COVID-19 preparedness and recovery funds. That's really designed to support businesses and taking necessary steps to reduce risk of transmission. I think there's also another out there related to prevention programs targeting specific industries like face shields for construction workers. But just wanted to ask, just so that we have some insight into what additional requests that we may receive as we prepare for next week. Are there any other requests that you guys are aware of that you're working on, or that someone in a roundtable may be working on?
I know the immigrant and refugee roundtable, we are working on it too.
Okay, great. Thanks, Pilar.
As is the vulnerable populations, working on potentially additional support for additional accommodations for COVID positive to isolate.
Okay, thanks, Katie.
And Maticia, did you mention the restaurant roundtable? I may have missed that, but I know they're coming forward with some.
I think the idea there is that some of those requests would be brought together in one request to support businesses in preparedness for COVID-19. So Maticia did mention that, but we're going to pull those proposals together into one idea.
Great, thank you. Also, I just will say that Ryan has prompted me. So I have, I think I said this, I don't know if I've said this to this group, maybe I have, but Ryan is like Voldemort, except he's like a good Voldemort. I've already said that before. That he lives in the back of my head with a text message machine and he tells me what to say. And so Ryan did prompt me to say, I think, something important, which is this doesn't have to be the last time this happens. That we could have a mid-August or an early August, or I'm sorry, a mid-August request or a late August request too. So just wanted to add that.
Okay.
Maticia, this is Lois.
Yeah.
I was going to talk about this in the update, but the other need that came up quite a bit in the community engagement survey that we did was cleaning supplies and lack of availability of access to and availability of cleaning supplies. We're asking people to, sanitize and keep things clean, and they can't find or cannot afford cleaning supplies.
Okay, thank you, Lois. All right, and so like Mayor Schul said, this is our first pass at bringing forth known budget requests at this time, and things come up as our work evolves. If there's additional things that come up, we'll figure out how we address those then. But are there any questions about the process? Because I know that the request is everyone get the budget proposal submitted by Monday. Is there any questions about the process? All right, here are none. I will ask Katie to provide us an update on the Back to Bull
Great, thanks.
campaign.
Well, good morning, everyone. And I also want to thank this group for just incredible work, continued work. As we look back, as Maticia said, as we look back over the last 60 or so days and everything we've accomplished together, it's a lot has happened, and there's still a lot of work to be done. So one of the big accomplishments is Back on the Bull. And it's really exciting that we went to a soft launch last week, and then this Wednesday, a formal launch of Back on the Bull. And I'm happy to say that we already have 160 businesses that have signed up and completed the process for Back on the Bull, for the voluntary self-certification, if you will, the checklist. That is more Durham businesses on Back on the Bull than Durham businesses on the Count on Me NC campaign, which actually has been up for a lot longer. And I think this just demonstrates the importance for our community of having something that is very local. And so I really want to thank Marielle and McKinney and Ryan and everyone who worked on this, because it's a beautiful campaign and a beautiful checklist that we think will really have a significant impact in this community. The other thing I want to update you on briefly is the face mask signage distribution. So you'll recall, as Mayor Schul said, the last week with the revised order, that now requires businesses to clearly post that face coverings are required for entry. And so we have printed up 1,000 signs for businesses. They are available in English and in Spanish with the Back on the Bull campaign of face covering required with the bull wearing the mask. It's a great sign. And distribution of those will begin today. We also, through the health system, donated 10,000 masks, disposable masks, so that we can provide a starter pack of masks to businesses, so that if someone comes up and says, and they don't have a mask, the business, instead of just simply turning them away, can say, well, here's a mask for you. And so working on getting those distributed this week. As I turn over to Rod, I'm going to go ahead because this is part of the next section and give you an update on the metrics for hospitals. So for Duke Regional Hospital and Duke University Hospital, and those are the two hospitals I'm focused on within our health system, simply because those are the two in in Durham. And so since we're focused on Durham, I'm not including Duke Raleigh in these numbers. So as of yesterday, we had 83 COVID positive patients between Duke Regional and Duke University Hospital. 27 of those were required ICU level care. In the last 7 days, we've averaged 70 per day, and our occupancy overall is at 89, 90%. And 7%, that puts us at 7% of our patients total are COVID positive. Since the beginning of COVID, we've had approximately 800 patients hospitalized across those two hospitals with an average length of stay of 8 days. 275 of those have required ICU level care, and ICU level care has an average length of stay of closer to 10 days. And of course, that is an average. To get an average, some patients are staying fewer days and some patients are staying significantly longer. So that's how we get that. So hopefully that gives you a good overview. Still have work to do to figure out how we, what needs to go potentially on the data hub, and I'll work with Rod over the next week or so to see how we do that. And with that, I will turn it over to our public health director for his weekly update.
Thank you so much, Katie, and good morning to everyone. Your briefing for July 17th. Within the US, we sit at roughly close to 3.5 million cases of COVID, resulting in 136,938 deaths. Within the great state of North Carolina, we're at 93,426 cases of COVID, resulting in 1,588 deaths. And within this great county that we are all working in, Durham County, we're sitting at 562 active cases, 4,245 inactive cases, meaning that many Durhamites have been discharged from COVID care. We're still sitting at 72 deaths. And we have a total at present of 4,880 total cases since the pandemic began several months ago. I'm also proud to report that we have, between Durham County Public Health and our CCTO, CCNC apparatus, we've made 9,565 total contacts of COVID positive cases. And our partnership with Duke continues to be thriving and a good thing. Our close contacts that we're contacting now are being ushered into COVID testing at Holton. That stood up on last Saturday, and so far so good. We're starting to see a lot of positive results in terms of directing the right patients to get COVID testing. I believe the first day was approximately 50% success rate. Out of the 68 or so, we ended up close to 30 positives. So we wanted to make sure that we stood that up. So I'll provide a little bit more update. In terms of trends, we seem to be trending in the right way. We're nowhere, by no stretch of the imagination, out of the woods, but as of Monday, July 13th, we were at 4,648 total cases, which represented a 475 case increase from last week. So the numbers are down a little bit. The most important metric, of course, is the 7-day moving average, which was 68. And this is down from 72 last week and 59 the previous week. So we continue to watch the 7-day average to ensure whether or not cases are trending up or trending down. So we are hopeful that they will continue to trend down. However, realistically speaking, we are waiting with bated breath on the activities from the 4th of July. So far for the month of July, we're sitting at 880 cases, new cases, I should say. And so in short, North Carolina's trajectory of confirmed cases continues to increase along with other states within the Southeast. Of course, we know what's going on in the Southwest, to include California and Arizona and Texas. But we're, from the perspective of state epidemiologist Zach Moore, we're not as bad as other states within the state of North Carolina. Durham's trajectory of lab confirmed cases are increasing slightly. We always want to talk about race, ethnicity, and work because that gives us a good indicator of what's going on locally, and nothing has changed from last week. We continue to see significant dips within the Hispanic Latinx community. They're representing 53.3% of our cases, although they represent 14% of our population. As I said last week, we are not letting up. We're continuing to make the awareness for our Latinx community known. Special shout out to Pilar. Last Monday, I believe she and I were on a panel sponsored by the Cooperative Extension, in which I was able to speak English for about 10 minutes through a translator, and everything else was totally in Spanish. So there's no limits to what I'll do to spread that awareness, but it was great being on that panel of subject matter experts with Pilar and several people from Lincoln, several people from Duke, and a couple of other healthcare organizations. Continuing on, then the Black and African-American community, they continue to be underrepresented, but we're continuing to watch this demographic. They represent 23.1% of our cases thus far in the month of July, though representing 37% of all Durhamites. And in the white community, very underrepresented at 15.9% of our cases, although they represent 54% of Durham's entire population. In terms of work, race, ethnicity, and sex, same three sectors that we're seeing in the month of July: unemployed individuals, construction work, and hospital workers. Hospital workers are representing 40.3% of our cases, predominantly in the Black or African-American community, and 68.4% were female. In the construction industry, which the Recovery and Renewal roundtables have focused on, 89.2% of our cases are still associated with construction work. They do represent majority Hispanic or Latinx, and 96.4% were male. And unemployed individuals continue to represent 65.3% of our cases, being from the Hispanic or Latinx community, with 75.8% being female. So we continue to work really hard on these particular industries. A couple of notes on the data. Just wanted the group and our audience to know that the median age of the unemployed worker with COVID-19 positive was 36. For construction workers, the median age was 37, and for hospital workers, the median age was 34. Painters and drywall contractors in July cases so far do represent 100% Hispanic Latinx per the data that we've received. And preschool and childcare workers who've tested positive in July were 100% females. Those working in elementary and secondary schools were 88% female, and those in janitorial services in this demographic were 84% female. So that's an important note as we, again, have worked with Dr. Mabenga, and the decisions have been made for the first 9 weeks to be online only. We certainly want the listening audience to know that public health is working very closely with Durham Public Schools, their administration, just to make sure that we are prepared if and when we have our kids go back to school full time. In terms of activities on the Data Hub, we continue to point our listening audience and everyone else to the Data Hub. We were able to give a presentation, myself and Deputy Health Director Tara Blackley. We gave a presentation to the Durham Partnership for a Healthy Durham on Wednesday. That was well received. We highlighted what I consider to be our crown jewel, which is the Data Hub, which really directs a lot of our data-driven decisions and provides a wealth of information to our listening audience for all things, where to go to get tested, resources, what's going on social media. There's a lot out there. One thing that we did in terms of geo mapping is we continue to highlight area zip code 27704 in the eastern part of the county, for it does have the highest rate of cases at 23.14 per 1,000 people. But one thing that we did do is that If you click on it, it also shows you within the zip code, it shows you the rate of infection and what's really going on in that particular area. So we want our citizens to know specifically what's happening in their zip code so they can be armed and understand why we preach staying at home, why we preach wearing your mask. We want you to have as much information as possible to keep yourselves safe. We were fortunate to receive Duke's model and their information, and they have indicated that the rate of growth for North Carolina is 2%, whereas Durham's rate of growth continues to be slightly less at 1.9%. However, more importantly, within the past week, the North Carolina's rate of infection has grown to 18%, while Durham's is holding steady at 13%. So all of our actions are continuing to pay dividends. I mentioned Holton, and again, just wanted to give some more information. The goal in partnership with Duke and our healthcare coalition is to test anywhere from 50 to 75 people by appointment only. And the testing does take place on Saturdays, Tuesdays, and Thursdays, with varying schedules, dates of hours of operation to accommodate working individuals. Pilar and myself were able to provide that information to our Hispanic community on Monday, because some of the questions that we did receive in the chat box were what is available for working individuals, particularly, specifically in the construction industry. So we were able to relay that information about the hours of operation. It is truly a community effort. Public health is, as I said, referring out close contacts, and Duke and public health are calling patients back with positive and negative results. We're very pleased with Duke's lab. You know, it's so many benefits of having a world-class teaching hospital in our backyard, whereas a lot of labs, as you heard within various news outlets, are having lots of trouble with reporting results, anywhere from 5 to 7 days, and that does not help our battle against COVID. Thus far, we've been able to get a very quick turnaround with our results through our effort with Duke at the Holton site. I don't want to jinx it, but I'm just going to say it's very impressive. So with that being said, we also concentrate on the whole Durhamite. While they're there, we provide education and materials, and we also provide food, particularly a box of food for a family that can feed a family of 4 for approximately 2 weeks. So we're continuing to do the best that we can and all that we can for our Durhamites. And this information was relayed to the state, and they're very complimentary of our whole person approach. So just wanted to share that with the community at large. Again, we're going to try to do all that we can for as long as we can with the resource that we have. Additional information about testing, and I'll turn it back over to our chairs. Testing is so important, ladies and gentlemen, because the testing that we do for COVID helps us to mitigate, helps us to identify and isolate where COVID is in our community. It's not without challenges or struggles, because there is a nationwide issue with reagents, and testing has kind of dipped a little bit nationally. We have been assured by the CDC and DHHS that they're working on it. They're working on other ways to collaborate with labs, be it subcontracting and other ideas. However, Durham continues to do a very good job with our testing. On average, with a goal of approximately 4,017 tests per week, Durham has blown past that tremendously, and I'm proud to say that it's a collaborative effort of pharmacies, doctors' offices, of course, Duke major medical centers, and you know, again, we continue to do extremely well in terms of testing. Some weeks we are at 5,000, over 5,000 tests, but on average, we're hitting that 5,000 mark, and of course, we want to continue to go up. So again, I implore everyone, if you're able to get a test, if you're considered to be a close contact, or if you just want that assurance that you don't have COVID, seek out Data Hub to determine where you can go to get tested. And all that information is out there on our Data Hub. I also want to pass it off to Dr. Ibukun Akinboyo to see whether or not she may have some additional commentary.
Thanks, Rod. Riley, you covered everything, so I'm grateful for your detailed summary there. I will mention one thing on data transparency. We're hearing more and more that people are concerned that as we move into the next few weeks and months, that there may be a change in how data is presented publicly. And I know Rod certainly is in support of this, and I'm sure we all are on the panel, but I think it's important to remember we've spent a lot of time trying to operationalize getting correct data and getting it out there. And no one is going to put a lot of time in trying to destroy all of that. So I think we're making decisions based on data, we're pushing data out, and we're going to ensure that we're making data informed decisions. So just to kind of reassure people that have questions around data transparency, as much as we can, we'll ensure that the correct data is out there and it can inform decisions people are trying to make.
Thank you, Dr. Akinboyo, Rod, and Katie for those updates. Are there any other questions or any questions for any of the three that you just presented on the metrics?
Maticia, I just wanted to jump in just to say and recognize Rod and Pilar and everybody who's been working so hard. I mean, it is, we can't take for granted the fact that we're moving in the right direction with the Latinx community. I just think it's really significant. Obviously, we have to keep working at that, but that's thanks to all of your efforts. And I also want to say that the county has given out, I forgot to mention this before, over 88,000 free face masks since the beginning of July to nonprofits, and we still have another 12,000 to go. So if you know nonprofits that need them, for them to apply. And thank you to Drew and Jody and all the county staff who've helped with that. Also, Rod was mentioning the wraparound support, I think is so important. And thank you for Rod, for everyone who's doing that, because we have also had about over 400 people sign up to volunteer through the Triangle Nonprofit Center to deliver food to people, like positive COVID families. So I just wanted to mention that. And the fact that Rod, you and your staff, we haven't seen some of the big outbreaks in the long-term care facilities that we've been seeing at some of our neighboring counties over the last few weeks. And again, I want to attribute that to your strike force teams and your staffs who got ahead of that very early on. So I think those types of efforts are really paying off. Thank you.
Thank you for that, Chair Jacobs.
I want to throw in a shout out to Maticia. I want to thank Geoff for the donation of the 10,000 masks for our distribution, along with the signs. Katie kind of mentioned that casually, but it deserves more than a casual mention. It's great. And I'm so appreciative when I feel like we're all really pulling in the same direction, and that so many of our efforts have come to fruition. Wendy mentioned this earlier, but when I think about the Data Hub and how good it is, when I think about Back on the Bull and how good it is, and we got a great article from Bloomberg Philanthropy praising that work, which is awesome. The work that Ed and others got going that now has produced Durham Has You Covered.com with the online face covering marketplace. Everything seems to be pulling in the same direction. I feel like I wish we had a unified national effort that felt like this. I'm just so proud of Durham and all of people here and in our community. I feel like we're just pulling together, and we have a common message. We have common goals. We understand, what the important data points are that we're all trying to look at and think about together. And Rod's report just kind of centered that for me, you know, that it's just so much is coming together that we're doing. And my gratitude is complete for everything that you all are doing. So thank you.
Thank you. So I think next up we have Geoff and Anthony to give us an update on the economic recovery action team or roundtable and the work that's being done there.
Thank you, Katie. Good morning, everybody. It's great to see everybody. Great to hear all of these updates. And I certainly echo Mayor Schul's sentiments in the fact that it's great to see this community really coming together and pulling in one direction. For background, by way of background, and I'm not sure if I'm supposed to share my screen or not, we have a quick 5-slide sort of summary on some of the work that we've been doing. But essentially, by way of background, we've established an economic recovery subcommittee, and that group has been meeting since June the 10th, every single week, for about an hour plus every single week, trying to take on what seemingly sometimes is an insurmountable task of what does an economic rebound, what does an economic recovery actually look like? That team consists of Susan Amey, Ed Boyd, myself, Dr. Nelson, Pilar Rocha Goldberg, as well as Nicole Thompson. It's been these are heavy lift conversations. Trying to understand even where to begin was a big challenging part. But I think we've made some significant strides on both focus areas, our metrics, our objectives, and strategies even moving forward. And I'm also very pleased to say that in many cases, the work that this task force is doing, as well as works of our representative organizations, have taken broad steps in starting to accomplish some of these tasks. What we've said as a group all along, meaning our subcommittee as a group all along, is this isn't a short game. To think that a rebound discussion or a rebound strategy or recovery strategy can be fully formed by the end of August, it's just simply not possible. So we're taking both a short-term look at things, a medium-term look at things, and then certainly a much longer view as well. Most of our discussions, not to oversimplify them, but many of our discussions are falling into two basic categories. One is the very basic need of current business survival, and then ultimately, second term is how do we get people back to work? So you'll kind of notice that almost all of the things that we touch on fall into one of those two categories in some form or another. And everything that we talk about and everything that we present comes under with the overlay of racial equity. So with that, I'll kick it over to Dr. Nelson, and he can kind of give us a general lay of the land and an overall snapshot of the conditions we're looking at. I'll kind of come back in and sort of wrap things up and talk a little bit more about some of the focus areas and objectives. And then we'll open it up, because our goal today is to hear from you all, open it up to our entire subcommittee for a Q&A and lead a discussion with the group. So with that, Dr. Nelson, please.
Thanks, Geoff. Looking at the screen here. Oh, okay, I can see the screen now. So first of all, I want to say a special thanks to Ryan Smith, who pointed us in the right direction of some good data sources. And also I want to say thank you to Dr. Nasir, who's a professor of economics in the School of Business at North Carolina Central. He assisted us a great deal. But just as an overview, almost 2/5 of businesses are minority owned in Durham. That's well ahead of the North Carolina and the US average. It's in the US, it's about 18%. Almost half of businesses are women owned. That's again well ahead of North Carolina and the US, where it's about 40% for the US. The largest industries are professional and business services, healthcare and social assistance, educational services, manufacturing, and hospitality and retail. And I'll touch on those industries in a moment. But we identified 3 primary key performance indicators: consumer spending, business strength, and unemployment. Consumer spending is the key driver to an economy. It's once consumers begin spending money, businesses will grow stronger, and as businesses grow stronger, they begin to employ people. Over the past few months, consumer spending has been increasing, but slowly, although January to April, with that big drop happening in March, as of June 30th, consumer spending was still down when compared to January, but only 17% when compared to again, January's numbers. The second major key KPI is business strength, which includes the number of small business openings and the associated revenue of those businesses. And the openings and the revenue have been increasing, but rather slowly. Just as consumer spending took a nosedive in April, the number of small business openings and the amount of revenue from those businesses decreased about 30% when compared to January's numbers. But now we're at about 17% off of January's numbers if we use January as a benchmark. Then unemployment. Unemployment is and will be the most challenging KPI to show promise, because it depends on consumer spending and business growth. Businesses will not be able to hire employees unless they grow. So last May of 2019, we were at 3.5% unemployment. May of 2020, we were at 11.2%. And unfortunately, the number of low-income workers who are unemployed has increased 37% from where it was in January. So those are, it's devastating for the low-income workers. Wages are increasing somewhat, but again, slowly. Low-income earnings have sort of stabilized, but the total amount of low-income earnings is about 35% less than January's total low-income earnings. In terms of the industry sectors, hospitality, retail, and manufacturing were the most affected. Hospitality and leisure lost most of the jobs. About 9,000 jobs were lost in this sector. However, between April and May, the hospitality and leisure sector picked up about 1,000 jobs. So there's hope there. This is some of the information that we've gathered, and we hope to inform our discussions. So I'm going to turn it back over to Geoff, who will talk about the objectives and the strategies.
Thanks, Dr. Nelson. So when we started unpacking really what we could do, what our areas of focus should be, and ultimately what our objectives are there, and then supporting strategies, you can imagine it gets to be pretty complex and very much sort of a very complicated web of if-then sorts of statements. But by and large, when you start looking at them, the issue number one is supporting public health measures. And the great work that this group is already doing is advancing that significantly. And I can't overstate enough, Dr. Nelson had mentioned the importance of getting consumer confidence. That Back on the Bull campaign for us, as much as it is about keeping safe, it is really also about building that consumer confidence, because that is, really the first domino to fall that goes from that consumer confidence that then allows businesses to grow, that ultimately results in additional hiring. The second is to promote and increase both resident and visitor spending in order to mitigate additional job loss. That kind of goes in that general that conduit continuum there as well. And I think that probably Susan will talk a little bit more about some exciting initiatives that they are working on at Discover Durham as far as like rediscovering Durham and that campaign. Very importantly, supporting the most effective businesses and workers, and what we can do in that space is very important. Our ability to support new businesses and job growth and job creation, to retrain and reemploy effective workers. And we have some exciting initiatives that I know Chair Jacobs has alluded to in these discussions earlier regarding building upon our local life sciences and that growing industry. And ultimately to strengthen education and career pathways. I'm very, very proud to say that organizations like the Chamber, DDI, Discover Durham, like all the organizations represented here, the Black Chamber, RTP, Duke, our large employers in Durham, our business leaders, we're really leading the way here with addressing some of those latter pieces. And since this group has taken on such a large piece of the first couple of measures, really is freeing up our public sector partners like OEWD and the team at the county to really focus on administrative and technical support. And so the partnership that Mayor Schul had alluded to about everybody kind of pulling in one direction is fascinating to see here. And as our team met over and over again and started kind of talking about these pieces that we had in place, we realized that ultimately a lot of these strategies are already being implemented or in early stages just by nature of the good work that we all do already. And so to align those and to refocus those became, we realized we're a lot further along than maybe we had originally thought. And so with that, I would love to kick it over to, actually, first off, anybody else on the subcommittee would like to add some thoughts before we open it up to the broader task force for a Q&A?
Not really, and thank you for representing our subcommittee so well. But you mentioned at the beginning having the racial equity piece, and I really feel we are doing this in the subcommittee, having all in consideration to work on. So I really appreciate that.
If I could speak to it a little bit from the hospitality sector, this is an area of our economy that's been hit the hardest, as Dr. Nelson was saying. And the mission of Discover Durham is about promoting economic progress in Durham by through a visitor economy and bringing visitors into Durham. What we've been doing right now is we've obviously shifted that tremendously and focused on how we can get people who live in Durham to spend money in Durham, continue to support our hospitality businesses. And as Geoff referenced, we have a campaign ready to go. We're waiting for the right time on Rediscover Durham, with the idea that in the short term, what we want to do is, as it's safe to do so, promote people visiting our local businesses, and especially restaurants, and as they start to open up bars and entertainment venues here in town. And then we will continue to expand the reach of those campaigns and that messaging out from Durham to broader audiences outside the county as it's deemed safe for people to get out and travel and visit. So that's a part of economic recovery, is our ability to get back to doing that.
Thanks, Susan.
I would be interested to know whether or not there was any discussion around the healthcare industry in general. And just to mention that the increased levels of unemployment has a direct impact on health insurance coverage. Many of those individuals get health insurance through their employers. So as we move forward, I think our healthcare sector, including public health, we have to pay very close attention to their needs, their economic needs as we move forward, because there might be a greater demand for services, but fewer patients with health insurance coverage.
Thank you, Mr. Harwood. That's a really great point. Thank you. We certainly have touched on from as far as a large industry, one of our most important industries is in that healthcare and social assistance, but that additional layer that you just introduced is very, very helpful. So I appreciate that. We'll absolutely be able to address that in future meetings.
And Geoff and Anthony, thank you so much. Everyone who's been working on this really important piece. I'm wondering if you are going to also identify the sectors of our local economy where there are the needs for jobs, and also where projecting out over the next 5 years that we see the jobs increasing, for instance, in life science and biopharma, and thinking about, and I know we are doing this with the Bulls Initiative, but also just on a broader level, identifying again where we can be redirecting people in our economy.
Thank you, Chair Jacobs. Yes, absolutely. That is one thing that this group has been keeping an eye on, is to see, while Susan has mentioned, the significant loss that our hospitality industry is seeing right now. The reality is we're also seeing some significant upticks in a lot of various different industry sectors. You had mentioned the life sciences. We've created a partnership that you're well aware of with Made in Durham and the Biotech Center, Durham Tech, DPS, the county representatives from the city are coming to the table to talk about building up local life sciences, BULLS, as an initiative to be prepared to meet the talent demands of this growing industry and to provide employment opportunities to those who are displaced, to align the pipeline for Durham youth to access these opportunities, as well as to increase the training infrastructure. My thought, and where this group is thinking, is what we learned from that is our blueprint, because there are other industries and industry sectors, the entrepreneur, the startup community, that we can learn from this and then guide this similar pipeline, putting the right partners around the table to kind of create that. So that is absolutely something that we are watching. I mean, the obvious industry that's in front of us right now is indicated by recent announcements with Eli Lilly and Grail, and continued expansion from existing companies here like Merck. Is this life science and this biotech is absolutely expanding, and we are adding jobs. But there are other stories, like the Policy Genius and the tech components of that, in that piece that don't require advanced degrees that are hiring as well. So how do we align all those pieces to take advantage of, again, like the financial tech industry, where that's going? And so we are watching those things, and those are regular parts of our conversations, because a critical piece, and that's sort of the second umbrella we had talked about, aside from keeping businesses surviving, is the potential opportunity to retrain for industries that are growing and people that are hiring, and to keep that talent pipeline Durham-centric and Durham-focused.
Are there other questions about the work of this group? I think it's really good work and really important work.
Thank you, Katie. I would like to say that there's a lot of other points kind of embedded in each one of these broader bullet items we touched on today, and we'll be prepared to kind of continue to address those specific issues and answer questions as our strategies continue to crystallize.
Great. Well, thank you. Again, thanks for all the work on this. Let's move into other updates and discussion from our action teams and roundtables. And we'll start with Lois with an update on the community engagement action team, please.
Good morning, everyone. You may recall a couple of weeks ago, I was away, but we saw the flyer and communications piece that had been distributed. It was to complement and expand the outreach that the task force is doing through the numerous agencies and organizations that we touch, as well as the great work that's being done by nonprofits, churches, and others. So the information piece with a brief survey was produced to gather feedback from the general public, particularly since the roundtables were focusing primarily on specific industries and sectors. We wanted the general public to have a way to voice their concerns. The survey was distributed relatively widely in print, mostly online through the city's website, Discover Durham, the mayor's Facebook page, numerous other ways. We received relatively small response, formal response to the survey. We received 111 individual responses to that 5-question survey. And just to remind you what the key questions were on the survey, they were, do you know the symptoms of COVID? Do you have what you need to protect yourself and others? Do you know where to go if you have symptoms? And the main thing we wanted to focus on was, what are your concerns? I want to give particular thanks and appreciation to Mary Grace Stone King, who is an intern with the city and she's a Master's of Public Policy student at Duke University, who assisted us in analyzing the results and the data. And there's a memo in your packet. If you haven't seen that, please take a look. But I wanted to share with you sort of the results of that survey, which primarily confirmed what we had already been hearing. The main concerns were non-compliance with guidelines regarding face coverings and physical distancing, reopening too soon, as I mentioned earlier, lack of cleaning supplies. People can't afford them and cannot find them. Other concerns included evictions and the need for housing assistance, particularly now that the moratorium on stays on rent had now being lifted for some. It wasn't voiced by a lot of people on the survey, but we have heard this quite a bit, is the lack of primary care doctor to either access testing or just for healthcare in general. A number of people, for them, not so much for themselves, but concerns for others, included the need for food assistance. And another big one included health and wellness in general, including access to physical and mental health services. Related to this, noted here was access to paid sick leave for people who felt as if they needed to be off work and could not afford to do so. And as we've noted numerous times before, a place to isolate or quarantine if you have you or a loved one has COVID symptoms. Also noted was the negative impact on the local economy and businesses. So as I mentioned, the survey primarily confirms a number of things or issues that we've already been discussing and trying to address here. So the two major questions that the subgroup, and I just want to restate that I've been working on this with Pilar and Ed, staffed by Amber, Quelly and Sharon, and a number of other city folks. So the two questions for the group today is, how can or will we respond and address some of the concerns that we're hearing, particularly as we're thinking about the budget process? And the second one is, what additional information would be helpful to us at this time as we track where we are and attempt to respond to hardships and human needs? We had a conversation in our subgroup Wednesday about, do we want to do additional surveying? As you all know, there are a number of surveys at the national level and around this regional level by different coalitions. Durham in particular, we can get survey fatigue, and we've heard that from a number of communities. But particularly at this time, what additional information would be helpful to us, and do we want to do additional surveying? And certainly one of the, Mary Grace mentioned that there are a number of students at Duke, UNC, and other places who would be willing to assist us if we wanted to do some survey. So again, those are the two questions now. How do we respond to what we're hearing in general? And do we need to know more?
Lois.
There's one item I would like to mention, and that is the coming flu season. We know it's going to come. So please, if we can keep that in our minds as we look to the future.
So, Lois, I'll just start by asking a question, because I think the concerns that you raised, or it's great to hear those concerns. Has the team thought about any proposals that they may have around some of the concerns that you just raised?
Yes, in our small group on Wednesday, as I lifted up before, the frequent note that lack of cleaning supplies and access to cleaning supplies, we didn't have specific recommendations for how we might approach that, but that is, in addition to face masks, people need cleaning supplies. So that is one that I would say, any suggestions on what we could do, might do to particularly support people who have limited income. And we know that cleaning supplies can be very expensive even when you can find them. And I think what we said, that since the other items had been lifted, for example, food assistance, support for housing assistance, we were not thinking there would be a specific recommendation from our group, but we would want to endorse other larger groups that plan to lift that up or to submit that as budget items.
I wanted to ask you, Lois, what you felt was, in terms of what do we need to know, what is the best way to get information about existing resources out to people? Because a lot of the things that you listed, for instance, about housing assistance, food assistance, there are efforts going on now around these. The city has gotten funding that now we're gonna be using that money in coordination with the county DSS we have significant over $1 million in funding that can be used for rental assistance now. And so we're setting up a program. We've already been distributing rental assistance through DSS. There is a coordinated food effort going on through the EOC, and that's ongoing. And Jody, maybe you can speak to us that there is going to be a campaign for donation of cleaning supplies. So I guess one of my thoughts is I feel like some part of the problem is that people don't know about the resources that we do have and how to get access to them.
Thank you, Wendy, for voicing that. That was part of our discussion in terms of perhaps working with communications and thinking about a no wrong door approach, whether you're going to a site to look for information on housing, you see the information on food assistance, and we do need a much more unified, comprehensive way to gather information and share that information through lots of places. I think we looked at, during our meeting, the town of Chapel Hill on their website. There prominently on the website and on the COVID website, there was a comprehensive list that you could click and see all of those things. So I'm sure there are models out there. I think that is something we do need to discuss. How can we be more comprehensive and unified in how we talk about all the services and assistance currently available?
Lois, I know you mentioned Duke students and UNC students. Have we also engaged NC Central students in this?
I am not sure. And again, working with our group was Mary Grace Stone King, who's an intern for the city, and she's with the Sanford School. Others may have more information on that, perhaps Ryan or Amber or others. I'm not sure.
Okay. On our student resource research team, we also have students from NC Central that Dr. Nelson has helped connect me with. So we do have representation from both of our local universities, as well as one student from UNC.
Great, thank you.
The other thing I would say is certainly all of what we're doing is community engagement and outreach, what all of us are doing. Depending on how we want to move forward here, perhaps that we should add some more capacity to the community engagement group, or think about perhaps having us align more closely with communications, whatever this task force feels would be the best way to make a little bit more progress.
It does seem like aligning some of this with our communications. I mean, most of the communications has been really focused on the Back on the Bull campaign, but is there a way to think creatively about how we get the word out about what those resources are that are already available?
I also had a really good conversation with our good friend Gina Upchurch from Senior Pharmacists and Durham Partnership for Seniors. And she shared a list of resources and what a number of groups are doing as well. And some of that really great work, was new to me. So I don't know, again, the question of how can we be more coordinated in gathering, compiling, sharing information among ourselves and with the general public.
Yes, and I think this topic came up in other meetings, like Latin 19 and other meetings, how we can, or where can we have this comprehensive list? Because even for us at El Centro, we are all day long responding to phone calls, people asking questions about different issues. So we have a list, but again, we have to update that list almost every week because changes almost every day, yes, depending on the resources of churches and nonprofits and everybody, yes, local government. So, but we have the same, and I know probably NC Care 360 is one place where, but not everybody's in that. So like us as El Centro, we are finishing up registering and having everything in there, but that question came up. So I don't know what other ideas are. Where can we really host that list that is continuously updated?
So if we had a list that were regularly updated, is there a way, I'm going to look to Rod and not to put him on the spot, but I'll put him a little bit on the spot. Is there a way, do we think, that we could post that on the Data Hub page so we have sort of one repository for the data, the testing sites, and the resources that are available in our community?
Absolutely. On the site, we have, we can modify because we do have that section for resources, so we can kind of make that a little bit more robust. But yes, ma'am, we are more than happy to help put that on the Data Hub.
The final thing I'll mention that came up as part of it was that, certainly a good portion of our community may not be online or accessing things digitally. We talked about it in the group as well as in my conversation with Gina around how particularly older adults access information, and basic ideas like including an information flyer with a water bill, continuing to use the public access channel as ways to continuously share information, but provide, whether it's a centralized number or someplace for those who don't have access to technology or not as digitally savvy to access information.
So maybe we pull a small group together I know we've already got the communications group, but I wonder if we have sort of those, our city and county public information offices in particular, and just pull a small group of us together to talk in the next week about that communication and, brainstorm those ideas like putting something in the water bill, et cetera. Maybe Ryan, I don't know if maybe you could help me figure out who we need to pull together. I'm happy to help facilitate it and work with you, Susan, so that it's not, because it's communications, but it's a little bit, it's almost a subsection of the communications that we're doing on the overall Back on the Bull.
Yeah, that's fine. It's looking at a particular target audience or a few target audiences and then figuring out which channels are best for reaching them. And yeah, we'd be happy to help with that.
Okay, thanks, Susan.
I ask one more question. Lois, I wonder about part of the strategy also being some personal outreach to, for example, church organizations, churches and civic organizations that I have been asked to be, so for example, to speak to Rotary and to a couple of churches. And I wonder if members of this group or others could, I wonder if that's something to offer. I'm not sure, but I would just like to ask you all to think about that and see if you think that's a good idea, where we could go and have Zoom meetings with, because so many churches are meeting digitally, and so many civic groups that we could perhaps, just have 5-minute information sessions, maybe from some of us and others. So I just wanted to ask you all to give that some thought.
I think that's a great idea, Steve. We could put together a presentation that anyone could lead or present, sort of thinking of it as a speakers bureau type effort to make it available. I will say, just based on, again, it was fairly limited, the response to the survey. We have not had a request for a specific community engagement round table at this point, but we're still continuing to reach out to see if that's something that would be helpful to people. But I agree, we can be even more proactive in saying we have people who are available to come and talk and answer questions.
And can I just jump in that Jody can be a good link for this, because we get what's called a SITREP report every single day. Durham city and county government folks, and it lists in that report updated information about resources, what's happening with housing, what's happening with food, some of these major needs that you raised from the survey. And so I think the EOC would be a really good resource for creating that presentation. Unfortunately, it's going to be ever changing, evolving, but that's where I find out a lot of my information is from that daily report that is updated. But I think that also speaks to the fact that if we have a more robust resource site on the data hub, even, we're actually going to need a person who all they do is continually modify and update that information. So that's something to think about, maybe for students, some of our students, or some who can do that.
And Chair Jacobs, as I mentioned last week, we have a pretty robust public information team that works on trying to get public information out since the COVID-19 response has started back in March. And Rod and his public information team have been really plugged into that. So if there's a way to get some of this information funneled through that group, they can use a lot of the existing resources that we've talked about, whether it's the data hub or some of the other resources that to get information out. The challenge will be is keeping that current and making sure that information flows. But I think we can think creatively about how we may manage that so that we're really sort of plugging this work into those existing resources and process that we have to make sure we have a broad reach and sharing information.
Great, thank you. This is a really good report and really good discussion. So I appreciate that and appreciate all the work on it. We'll follow up next week around the communications. Pilar, I think you have an update for us on the immigrant and refugee roundtable, including some requests specifically from that roundtable.
Yes, thank you so much. There is a letter we wrote as a group that is in the package for today. So I'm not going to read all the letter, but again, to remind the group that all the issues we are seeing in our community members, some of the gaps existed before and are, deepened by COVID-19. So we are seeing all these barriers. So We have a list of recommendations that the group asked for, and one is expand free COVID-19 testing and have mobile sites that go to where our communities live and work, especially construction sites. The second one is pressure the North Carolina Department of Labor to require more protections for North Carolina workers, including mandated paid time off for workers if they have tested positive. Request Durham County Health Department to actively reach out and help small businesses provide face masks or covering and other PPE to employees. While we acknowledge that it is a responsibility of businesses to help protect their workers, we also know that many of our small businesses are struggling to fill this demand. And I'm going to read them all, and I know we are working in some of these so we can respond to the group. Increase funding for rental assistance from city, county, and state. Target rental assistance to those who have contracted COVID-19 and must quarantine. Cash assistance and a city county resource list to those who have contracted COVID and their household members. Help to acquire dedicated free housing for residents who have tested positive for COVID and can't quarantine safely at home. Target reduction of the spread of COVID at construction sites and other high spread work areas to focus on social distancing during meal lunch times and in transportation to and from work. Incentivize the implementation of good practices versus use of enforcement. Some examples: free lunch or gas cards provided to workers. This could also help our local restaurants that are also struggling during this time. So those are the recommendations from the group. And we discussed, mainly what we've been discussing in the task force, and we are working in the different roundtables and subcommittees, is how we can help our community economically, but also, isolating and having all the resources they need to really comply with the 3 Ws and the requirements for COVID. And another thing that came up in the conversation, and it is in the letter, is having in consideration for some of the resources that are out there, the requirements. We are asking people like for rent assistance through the county or social services, having in consideration, documentation and other issues that probably our community members, but for our community members is a barrier to access to these resources, as the same with the business loans that are out there.
Thank you so much. Are there questions on that? And can we talk a little bit about sort of what we are doing and where else we may be able to help in terms of advising the mayor and chair in their work?
Yes, and sorry, to complement a little, I bring an update from the task force every week, and we know we are doing more testing and other things, but still some concern about, the mobile testing, and again, all the other resources for communities who have COVID.
I wonder, what is the thinking for those of you all who, I guess this would be for Rod and Phil and Katie and Ibukun, especially. What is your thinking around mobile testing, and what's the current status of thinking about that?
So I think we're continuing to explore all options, and certainly have been talking about all different options. We think that the Holton Clinic is a good expansion at this point, but I don't think we've taken mobile testing off the table. I don't know. I would look to Rod to maybe add into that.
I would concur, Mr. Mayor and others. The only reason why we've not really plunged forward with mobile testing is because in our efforts to really employ targeted, intentional testing, we just felt like mobile testing was more kind of invasive in certain communities. For the most part, we just felt that we didn't know how much good it would come out of it. So we really wanted to follow the data and determine exactly where we're seeing it. As I've said so many times before, I think I say it in my sleep sometimes, zip codes 27703 and 27704 is where we're seeing the majority of the cases come from. And it's important for everyone to know also is that when we do our contact tracing and investigation, we painstakingly go through every medical record. And we try to obtain as much information as we can. I know a lot of other counties don't do that. So again, to address your question, Mr. Mayor, we have been very patient. I'm pretty sure Katie can attest. We've been very patient with the state because there's supposed to be some significant resources coming. I feel as if I say it every time, and sort of like the whole denominator positivity rate, it pains me to not be able to produce a deliverable. But it's our understanding that, as a matter of fact, we have a meeting later on today. We're supposed to like really launch strong initiatives to test massive amounts of people. Of the vendor, they're going through their final RFP process. And the main areas that I really wanted to target, which working with Pilar, working with Latin 19, it will, in my opinion, be sufficient to reach that targeted area because there's certain stipulations that we have to comply with in order to make sure that we fulfill the requests of the state in order to get this money. So I know I'm a little bit all over the place, but again, mobile testing was not necessarily something that we thought would probably be advantageous. I know there's many individuals who are advocating for it, but there's a whole lot of logistics and a whole lot of planning that goes along with it. And our logistical plans kind of really centered toward Holton and eventually leaving Holton and coming to El Centro Hispano, and also possibly working with Anthony Scott and the Durham Housing Authority. There's a number, and also Reverend Herbert Davis, there's a number of people who have been patiently waiting on us to make these decisions. So I thank them for their patience, and I do believe that our actions will be coming online sooner rather than later.
Sorry, Rod, thinking about this, we are, I don't know if you've heard, part of one of the 5 organizations who receive money from the state to work with the Latinx community around COVID. And we got a list of some of the places they are targeting this mobile testing that the state is doing. So probably, Rod, we should get together and see if we can put something that I can forward to the state to see if we can get them come to the specific places. So yeah, I just thought about that.
Absolutely.
I just want to say that maybe we shouldn't use the word mobile, but maybe just temporary testing site, because I think the problem is just access and transportation, and with the zip code that you've identified, Rod, 27704, us really focusing resources in that zip code is important. And I know we're waiting on the state for those additional resources, but we know that we do need more resources in those parts of our community, and that we have to make it easy for people to get access to them. So whether it's, on a bus route or just, someplace that people normally go to. And I just also want to mention, I saw that the governor has released, DHHS has released a screening tool in Spanish that we should also try to promote, that people can use to, and I mean, that's a discreet way that people could use it and then see that they need to to go get tested. So I don't know, maybe we shouldn't use the terminology mobile, but targeted, I don't know, accessible, but I think we definitely know we need more access for our refugees, for our immigrants, for our most vulnerable residents.
To add to that last comment, I think we have pushed to decentralize testing because it appears to limit access. I like the idea of mobile testing. I don't know if what resources we have currently would actually fit with the way we all imagine mobile testing to be, which would be some type of structure that actually moves through our communities and can test on site. I'm not sure that would be the most feasible solution right now, but decentralizing where and how people can get tested and ensuring that it's targeted to communities that are either most at risk or most affected will likely be best. And that does sound like what's already going on, although we might need to put some more resources or push that timeline a little bit quicker than our initial attempt. And that will take some state support and locally, maybe some additional support to the activities that are already going on.
Rod, is it clear? I know I asked you a few weeks back, the requirement or the prerequisites that someone would have to even get tested. Has that changed at all? I know that at that time, just any day citizen who wasn't showing symptoms or could not attest that they've been in contact couldn't just get tested. Has that changed recently?
Not really. Most of the changes, Ed, and that's a good question. Thank you for asking. Most of the changes have come along with the symptoms. But in terms of who can get tested, they are still encouraging individuals who may consider themselves to be close contact. They have attended, protests or rally where their voices were being heard, large gatherings. I mean, they're encouraging that because they know that the transmission of this COVID is so high. So that's pretty much like where it is, but not much has changed as far as who can get tested.
At Lincoln, the factors that would prevent us from doing mass testing are all around workforce issues and logistics. But we're open to the idea. We've just not been able to figure out how to do it thus far. So we focus on a whole person approach to most of the services we provide. So if someone calls us to be tested, we want to make sure first that they have a primary care medical home. So if they don't have a PCP or PCMH, what we'll do is register them as a Lincoln patient. And what that then guarantees is that we're going to follow up with the results. And if they need additional care, they'll be able to come to Lincoln for that care. So that has been our emphasis. So with additional resources, maybe we can do mass testing, but currently we're trying to use like a whole person, comprehensive approach to providing services to the Lincoln patients. And when I say Lincoln patients, current Lincoln patients, but anyone out there who needs to have a test, who's not a Lincoln patient, they can call up and we'll register them as a patient. And because all of our testing currently is by appointment only.
One thought I have is that and I'm sure that your roundtable's thinking about this, Pilar, but to turn some of these things into explicit budget requests through the process that Maticia has described, I think would be important.
I think the fear that we've been experiencing is that there may be some gaps in our data, because just the availability or the people that are able to get tested. And I think we all know, well, let me just speak for myself. Personally know many young people that have experienced symptoms, so to speak. And then, they just decide to kind of lay out for a couple of days or a few weeks or whatever it is. And then we know there's so many of us that are walking around asymptomatic, especially in the Black community. and so I think some of the data may then be, I hate to say skewed, but to that point is, I guess, is what I'm trying to figure out is if there's not an availability for anyone to just go get tested, and obviously I know that burden can't fall on this task force, and one of the requirements is a symptom, yet asymptomatic is one of the quote unquote symptoms of having COVID-19. It just seems to be I guess a catch-22 at the best case scenario. Worst case scenario, we're loving the work that we're doing without the understanding that we actually may be having some failures and some blind spots that we just can't even we can't even imagine how to address. And I guess that's the fear there.
So to speak to that a little bit, I think from a state level, there are caveats for people that are asymptomatic to get tested. And the order that came from the state does allow for essentially anyone to get a test. I think, particularly for those of us that are currently on this call, I think that we're referring to some of the avenues within Durham, and we still have somewhat limited testing capacity. I think we have enough. If we need to use them, we haven't maxed it out. But in that context, most of the avenues include some questioning about what your current exposure or symptom might be. And then there is at least one option where if you're part of a population that's been disproportionately affected, and right now that would impact Black and Latinx populations, those groups can also get tested. It does require some effort on the person that's trying to get tested, and I recognize that could shift people from trying to pursue this. So if you have to register, if you have to become a patient, if you have to show up somewhere, schedule an appointment, we recognize those instead of just clicking a button on an app or something. That clearly can decrease compliance with testing. Yet there have been so many different ways to reduce all of those burdens. It's hard not to include tracking of some sort because we would lose out on truly knowing who's infected, who you've been exposed to, if we don't collect at least the bare demographics. And Rod can certainly speak to the necessity to have a process before getting people testing. If not, we could go around and just swab people as you walk along the street, but that would essentially not prevent COVID transmission because we need to trace people.
Thank you for clarifying that and educating us, continuing to educate us. Are there other questions on this? Okay.
Katie, I see a comment in the chat, a question that maybe Pilar could address regarding, it's from Bea Caracta. What messaging is being explicitly put out to the Latinx community that ICE will not be given the information and it won't be used as a public charge to get tested or get care? I wonder what the state of discussion of those kinds of things is, Pilar.
Yeah, thank you. Yeah, we've been talking about this and having some of these questions about all of this. We've had some announcements at El Centro doing it, so this won't be used as a public charge. And what we've been getting from officials is that this information won't be shared, but we can't really assure as an organization all of that. But what we've been telling the community members is you have the right to, have the testing and won't be in the public charge. For sure, we know that piece. But still, a valid fear for our community members, unfortunately.
Yeah.
All right, thank you.
I was just going to ask Pilar one follow-up question, because we've gotten, a letter has been written to the task force. And so what's your recommendation in terms of how do we respond to that letter?
Yeah, I would say for the recommendations letter, yes, we are talking about, yeah, I think if we, I can address some of these pieces from what we've been doing, but then I would like to have more input from the task force to respond to the group. So I can start, something and then share it with you, and then we can respond. We meet, actually, we are meeting now every 2 weeks, but we can send the letter, and we are planning a town hall also. So I guess this will come up on the town hall. It's planned right now for July 27th in the evening. So I will send the information to the task force too. Thank you.
Okay, great. Thank you.
Great, thank you. I know we wanted to have some brief follow-up, and we are getting close on time, but brief follow-up on the entertainment and events roundtable. And I recall we were going to take back to that group to get their input in terms of the timing of when we would not have any large gatherings prior to the end of September. So October 1st being the date. Did we get any input from them? And I also wonder if there is, part of the way we came up with that date was based on getting kids back to school. And I don't know if there's any change with the announcement that came out from DPS last night that kids are going to be back online, if that changes in any way our recommendation. Do we have any update from that group? I don't know if they met this week or not.
I can say that we are planning that discussion for next week, but I don't know if others have gotten input on that date that was discussed last week yet.
All right, so we'll add this to the agenda for next week for a brief update. And again, just as a reminder, in terms of our role is really to advise the mayor and the chair. We would advise them in terms of what the task force recommends for a date, and then the decision would be theirs as to whether to accept that or not. Anything else there? Any other updates, Brian, from roundtables that we need to be aware of?
No, I would just say good morning to everyone, and thanks for your continued good work. We do have 6 industry roundtables that continue to meet weekly, in addition to these place of worship, the community-facing ones that have been referenced already. And I'll get back to making sure that you all have reminders of when those weekly ones are, as well as the non-weekly ones. But just because I want to make sure that it's given clear praise. I think the Back on the Bull launch has been great. I want to again applaud the Center for Advanced Hindsight and their continued commitment to adding additional industries as we're able to do that. I also want to thank Tilde, who has been great in helping with some of the translation of those tools that have been put out there already. And I think we're looking to integrate more language justice into the roundtable work and into other elements of what we're doing as a task force. And so just a couple of shout outs there, and happy to take any questions, but we're continuing to see some great creativity with that entrepreneurial spirit that we know Durham has, particularly in the affected industries. And we will look forward to continuing to support one another.
Thanks, Brian. Are there any questions or comments? Okay. So this is our time for open dialogue. Anything that we haven't had an opportunity to discuss yet today, and really, I think very good dialogue today, and I really appreciate that. But are there other topics that we didn't get to today that we should talk about now, other questions that have come up, or anything that you would like us to make sure we include in future agendas?
So there were two things that came to me. One was a question about child care centers, whether or not we'd had any concern or outbreaks at local child care centers. And the second was something we touched on last week, which is the impact of the return of college and university students and faculty. And specifically, the question was whether or not the students were being required to be tested before they return to campuses.
So we have meetings scheduled with Duke and NC Central coming up in the next, I want to say 2 weeks. Look to Ryan to confirm that, but next couple of weeks. And then we will report back to this full task force once we've met with them. And then I would look to Rod may be able to speak more to the childcare piece and any outbreaks there.
Have not necessarily been defined outbreaks at childcare centers. We've had a couple of situations. Have we had positive cases, Lois? The answer is yes. But we've not had anything along the scales of major outbreak as defined by the North Carolina Department of Health and Human Services. But as we've been doing all along, Lois and others, we've been dealing with every situation on a case-by-case basis.
I had a, oh, sorry.
I was just going to say that at North Carolina Central, to my knowledge, there is no requirement for students to get tested coming back at this time. There is a requirement that students will have to wear masks when they attend classes.
And from a communication standpoint, we're looking at how we can partner with the universities on communications to students and support those efforts as a very important target audience.
I had a question about the let's get back on the bull campaign in terms of the distribution of the posters. Are the posters going to be targeted at the first 1,000 businesses that join? Is that linked, about in terms of who gets the posters? Just wondering how that's being determined.
Not necessarily. I do think, so we just got an update from Mariel. We've had 204 businesses participate so far. I think that was the latest update. We certainly want to get those businesses signs. I do think we want to take these 1,000 signs and make that are the face covering requirements and make sure that we're targeting them in the areas of businesses that might be at highest risk and most need to reinforce that type of messaging. So we're working on that strategy with some initial signs beginning to go out today, but it will take a couple of weeks to get them distributed. And if task force members have ideas or suggestions, or if our public health department on how best to think about the strategy for getting out the initial 1,000 signs, please send them to me. And we're certainly going to be producing, I think, more face mask signs like this to get them out and other types of signage. So.
And Ryan, will there be a budget request proposal just related to things like, producing more of these really high quality signs, and any other kind of swag for the campaign that we can get to businesses for free? Is that going to be any part of a budget request?
That's part of the communications budget request that would cover that. So absolutely, Madam Chair.
And I just want to say, I'm really excited to next week to see all the budget requests, because to me, this is going to be something, concrete that's coming out of the work of the roundtables, things that are bubbling up, from the community, that we're hearing from the community of what the needs are. And I think that this is going to be a very important expression of us taking action on what we're hearing, that and moving that forward. So I'm looking forward to that.
And with that said, I think that's a perfect segue for me to kind of close this out, because I'm going to talk about a few things that we've discussed today. And I just want to let the task force know that Katie and I met earlier this week, and we've already decided that the bulk of our agenda for next Friday will be reviewing the budget request and making sure that once we conclude our meeting, we're able to put forth a recommendation to Mayor Schul and Chair Jacob. So just want to give you that heads up. And please make sure again that you get the budget request in so that we have the time, the small subcommittee, we have time to go through the information and put forth a recommendation to the task force. I know just based on the discussion that we've had today, the community engagement and outreach, Lois, I know there's a request I think that's coming forth related to cleaning supplies, but if there's other considerations that you need to put into that budget request, just kind of keep that in mind. Another item that we also talked about today is Katie and Lois, you're going to work on convening maybe a small team to help us determine the best way to go about trying to educate and increase awareness on some of the resources that are available for some of the concerns that you did raise, Lois. We also talked about Pilar is actually going to work to draft a response to the recommendations that we've gotten from the Immigrant Roundtable, and she's going to share that with the task force so that we can respond to the recommendations that have been brought forth. I can't even read my handwriting anymore. Another item that we talked about was we're going to have the entertainment committee come forth next Friday with the recommendation or the language related to gatherings, taking into consideration that when we made the recommendation that we would defer gatherings through the end of the third quarter, which is September, that one of the bases for doing that was the fact that we said we wanted school to start to convene again to see how things were going. And now that that's changed, if there's anything that we need to change as it relates to our recommendation, then hopefully we'll have that shared next Friday. So those are all the action items that I have. I do appreciate, again, everyone's hard work, your continued engagement, lots of great conversation during this meeting today. So thank you all for your questions, for the information that you shared. If there's no other questions, because we do have 3 minutes, so if there's no other questions, I'll pause. Anything else? Hear no other questions. Just hope that all of you guys have a great weekend and continue all the great work that you do for the task force and all the great work that you do for the other areas in your lives that we may not know about and don't ever talk about. But thanks for all that you're continuing to do.
Thanks, everyone. Have a great weekend.